And welcome back to Ask the Doctor. I'm your host, Mike Berger. We've been talking about the Reed procedure for treating the worst migraines. And remember, we're also taking your calls and email questions. The number is 1-855-5-MIGRAINE. Or you can log on to www.readmigraine.com. Joining us now is Kay Shurtleff, who's been suffering from headaches since she was 15 years old. Kay, how often were you having migraines?
Well, when I was young, I had them once a week, twice a week, something like that. And then as I got older, different things happened, and it gradually got to the point where I was having them 24/7 for the last 6 years.
24/7 for 6 years?
Yeah.
What in the, how did you do that?
Well, you would do the same thing. I mean, you have to make the decision, either I'm just going to hide from the world, or I'm just going to put one foot in front of the other.
Well, what type of procedures did you go through? Because obviously with pain like that, you're looking for some help.
You are. I saw several neurologists. I have a wonderful neurologist, and we did 67, something like that, different drug protocols.
67?
Mm-hmm.
Wow.
And then we tried lots of other things, trigger point injections here and here, surgical nerve block, acupuncture, chiropractic, massage therapy.
And you just have to feel kind of let down, because you go home and you and your husband, your husband says, well, how did it work? And he says, not so well, nothing happened.
Yeah, you do get to the point where you just think, nothing, this is just it, nothing's going to work.
Well, how did you hear about Dr. Reed's procedure?
The neurologist that I see, we talked about different options, and his nurse practitioner actually mentioned, this is something that's out there on the horizon. And then I decided to get another opinion from yet another neurologist. So I saw her, and she looked at all my records, and she said, well, I can try to treat you, but my first suggestion would be that you would go to Reed Migraine Center.
So now earlier, Dr. Reed told us that when the patients come in, they actually do a test procedure. How did that work for you, and were you a little nervous about that?
Not really nervous, because it's it's a win-win kind of a thing. Nervous a little bit that it wasn't going to work, and it was just going to be one more thing that we tried.
Okay.
But the procedure itself wasn't any big deal at all. In fact, I went to work the next day with it.
So with that procedure, with the test procedure, did that indeed help your migraines?
It did. At 4 o'clock in the morning, I woke up the day after the procedure. Well, I'd had the procedure the day before, and at 4 o'clock in the morning, I woke up because I felt like something's wrong, and realized it's because I didn't have a headache. So I woke up my husband and said, you got to know this. My head doesn't hurt anymore. Wake up.
That's got to be just an incredible feeling that for once in 6 years.
Yeah. Yeah. I went from just saying every day to my husband, if I could have 5 minutes without a headache, I could do all my thinking then, and then I could just function.
Yeah. So now you're ready for the procedure. We've tested it, seems to be working. Go see Dr. Reed and get it done. How did that work out?
It was wonderful. I mean, we had a little party in the hospital room that night. It's been, 13 weeks and 3 daes, and we celebrated every day.
So you've had it just, about 3 months ago? Mm-hmm. Is that it? And every day now, migraine-free.
Every single minute of my life is different.
That's incredible. What's it like living with that neurostimulator? Because I know you have a little battery implanted in your hip.
It's really not a big deal. You don't feel it. You don't really think about it unless you feel a headache coming on, or you can sort of do a preemptive strike and change the setting if you think you're going to be in a situation that's going to cause a headache. But other than that, it doesn't really affect your everyday life.
So how do you change that stimulation?
You have a little remote.
Oh, you do? So it's remote controlled.
And there are a bunch of different settings, and you can change it if you want to feel it more intensely here and less here, then you can regulate that. Well,
I would ask the question, how do you feel now that you've had the procedure? But I would say you're probably the happiest woman in the world.
I sure am. And it's the difference between saying, I wish I could have 5 minutes to have a clear thought, and saying, oh, let's go walk the dogs, let's go to a movie, let's plan a trip to Ireland. So all of those things are things we couldn't do before.
Now, I know since you lived with something that long, it's real easy to wake up one day and you don't have a headache, but you're saying, I wonder if this is coming back. I wonder, is it still just too good to believe, but it really works?
It is kind of surreal still at this point, but it's never, I've had one day that I've had kind of a headache that I couldn't quite get under control. My worst days now are so much better than my best days were then.
That's an incredible story. I am so happy for you, and I'm sure everyone is. It's something to look into if you suffer from migraine. Thank you so much again, Kim, and we are going to return and we'll look at the process to see if you're a candidate when we come back with more Ask the Doctor. Stay with us.